to thank Ivey for the opportunity to be here today and to address this important issue. My message today really will be twofold, and I thought it would be important to give you some insight as to what one of the key chronic disease issues that we're dealing with in the country will have an impact on the system, on the overall economy. It's a message both of a little bit of shock and awe, and but also a message of hope. So bear with me as I take you through this, because it's absolutely critical. Diabetes is placing a tremendous burden on the healthcare system and the very economic prosperity of our entire country. So just a quick recap, diabetes is really, first of all, split into three groups. Type 1 diabetes, where the body cannot produce insulin. Type 2, where the body cannot use insulin effectively, where glucose levels rise and serious complications can arise from that. And then, to a minor extent, gestational diabetes, which occurs in about 3.7% of pregnancies. But it is important to note, because a lot of the children who are born in those pregnancies will go on to develop a diabetes. So we need to be cautious about that as well. But the vast majority of diabetes in this country today is type 2 diabetes. It's a very serious disease because of the serious complications. In fact, about 80% of the costs in managing diabetes are really the serious complications of the disease, rather than actually managing the disease itself. And that's very important in the consideration of how we look at the management and what we need to do from a long-term perspective. On average, diabetes uses up about 2 to 3 times the health resources in the general population, and approximately about 10% of all acute visits to hospital are as a result of diabetes and those complications. Diabetes is an epidemic in this country, and in fact, it's a global pandemic. Last year, in 2009, the Canadian Diabetes Association released a report which we entitled "The Economic Tsunami: The Cost of Diabetes in Canada," and I think it was a very appropriate title for the release of the report, because we really are facing a tremendous wave in terms of the significance, the prevalence, and the cost of the disease. We are looking at trending from 1.3% of the population, 1.3 million people, which represents about 4.2% of the population, to about 2.5 million diagnosed Canadians today, which represents about 7.7% of the population. And if we project that into 2020, if left unchecked, we are looking at a very significant rise to 3.7 million Canadians, 9.9, almost 10% of the entire population. Now, there's also the 6 million Canadians who are living with prediabetes. Prediabetes is a condition where your blood glucose levels aren't quite at 7 millimoles per liter, but dangerously rising to that level. And it's important because if untreated, 50% of those individuals will go on to be diagnosed with type 2 diabetes. So the significance is huge, the numbers are large, but what's also very important is the cost. Right now in the country, about $12.2 billion in terms of overall cost, looking to rise to nearly $17 billion by 2020. This is all very important because this is a significant draw both on the healthcare system and on the overall economy, as I said. And when it comes to innovation, this can be somewhat limiting if we don't deal with it. And a lot of innovation will be required in terms of dealing with the issue itself. If we look at the cost model on a provincial basis, and we've been able to break the data down, 2 important facts that come from that. The highest rate of incidence increase will happen in the province of Alberta, and the highest rate of prevalence right now in the country is in Newfoundland. And I was out Newfoundland and Labrador, and I was out there last week to address this model, and I can tell you, if left unchecked, if you add in diabetes, pre-diabetes, gestational diabetes, and the risk factors of those, you're talking about 40% of the population of Newfoundland and Labrador by 2020. It's a significant impact, and the numbers are only slightly less for the entire country. So it's a big issue that needs to be dealt with, and if we look at the costs, equally compelling. As I said, on the national basis, it's substantial in each of those provinces. It's a great deal, a great draw on the system, a drain on the system, and something that needs to be dealt with. So, in terms of dealing with this prevalence, first of all, we have the highest, third highest mortality rate in the world amongst our countries of an equal nature. Third highest. We take a lot of pride in this country about our healthcare system around delivery, design, but at the end of the day, we have the third highest. And that's just unacceptable. What it really boils down to is that we have an aging population and we have a sedentary lifestyle for the most part that are conflicting or compounding issues relative to why these incidences exist and why those prevalences and costs are going to rise for the future. It really is, for our country, a locked-in issue. There's not much we can do about an aging population and a population that isn't coming in behind to support that. So what we need to be dealing with is really managing the issue today. And so really the addresses that we've had across the country in the last 4 to 6 months have really been around a call to action. But as I said, there is a message of good news here. First of all, this is treatable. Diabetes is treatable. There are excellent treatment options that are available. And the second thing is, if we treat diabetes, there's a tremendous savings to the cost to the healthcare system, which in fact, in the end of the day, will lead to a lessening impact on the overall economy. So the good news is there are things we can do, there are things we have to do, and when we do them, it has a very positive result. Also, as we go forward, we can approach this in a very simplistic way. The first step is in primary prevention. We need to get down to healthy weights. We need to eat more nutritiously. We need to be more active. Those are things that every Canadian should be doing. It's something that helps across the entire spectrum of chronic disease, and it's most important in terms of preventing primary prevention of diabetes, as well as secondary prevention for those who are already diagnosed. And that really is one of the other elements in the three-pronged attack, is making sure that we're looking after secondary prevention from those complications, the heart disease, stroke, kidney failure, amputation, and blindness that are all associated with the disease. So in addition to those primary prevention factors, we need to have fair and equitable access to medicines, to devices, to supplies, to healthcare professional teams right across the entire country. And making more healthcare professionals available isn't the only answer. We need to be driving people to be engaged with those teams. We need to support them and assist them with that as well. And that's where there's a very important step in innovation required, because up until now, I think the ministries of health around the entire country have been working towards a solution that says if we make it available, sort of if you build it, they will come kind of phenomena. And making it more available, of course, is important. But driving people, educating people, driving them to the healthcare professionals, and doing everything we can to ensure compliance and adherence is going to be very important. And I believe that that's going to be one of the areas where we really need to step forward with innovation. We have to be very creative, because the traditional methodologies that we've deployed to date simply are not working. Otherwise, those numbers wouldn't be occurring as we see them. And then finally, we need to also be looking at-risk populations, because there are many in this country that need to be dealt with, and we need to continue to have approaches to deal with them in that regard. So, in conclusion, diabetes threatens all Canadians, both from the healthcare system sustainability as well as of our overall economic prosperity. Secondly, we can tackle diabetes, but it's going to take a central lead with a lot of cross-functional and multi-sectoral support. And then thirdly, the majority of diabetes is type 2 diabetes. Effective treatments exist. Access to those treatments must be deployed, and we need to apply innovation necessary to ensure that we're doing that, to reduce the costs and to ensure that we are taking advantage of all those opportunities before us. And with that, I will conclude my remarks. Thank you.